Assalamualaikum and good morning everyone. This is about the muscles of the lower limb and important spices. Okay, I'm going to talk about these three big topic, the fascia, the muscles, which includes the muscles of gluteal region, muscle of the thigh and muscles of the leg and foot, and intermuscular spaces. Okay, the fascia. Okay, it is a sheet of connective tissue that is found below the skin. These tissues attach, stabilize, impart strength, maintain muscle patency, separate muscles, and enclose different organs. This is the definition of fascia. So in our lecture today, the fascia that is explained is about the fascia that separate muscles in its compartment. Okay, with regard to the fascia of the lower limb, we have superficial fascia, which is a loose connective tissue that blends with the loose connective tissue of the skin, and deep fascia. Okay, deep fascia is dense, irregular connective tissue, while the superficial is loose connective tissue. Okay, the deep fascia is the connective tissue layer that located between the superficial fascia and the muscles. For the lower limb, we have two deep fascia based on its region. Okay, first is the fascia lata, is the deep fascia of the thigh, and the crural fascia is the deep fascia of the leg. Okay, the deep fascia is further extend deeper to separate muscles in the lower limb. Okay, whether it is in the thigh or in the leg, the muscles are grouped into few compartments, and the compartment is actually formed by the extension of the intermuscular septum of the deep fascia. Okay, they divide muscles into in the leg and also in the thigh into few compartments. Okay, this is the intermuscular septa. Okay, this is the leg. Okay, the cross section of the leg. You can see this is the intermuscular septum. Okay, which is an extension of the deep fascia of the leg, which is the crural fascia. Okay, what is the clinical anatomy that related to the deep fascia? It is the compartment syndrome. Okay, compartment syndrome is defined as a painful condition that occur when pressure within the muscle. Okay, look at this picture. The pressure within these muscles is increased. Okay, what causes this pressure to build up? It's either due to the fracture of the related bones or the injury to the surrounding muscles that cause inflammation. When the tissue inflamed, the pressure will also be increased. So when the pressure within this compartment increase, so what happened? It will compress the vessels that are located in between this compartment. So this will decrease the blood flow and prevent the nourishment and oxygen from reaching nerve and muscle in this particular compartment. So in a patient with compartment syndrome, it is considered as emergency. So um, uh, a surgery known as the fasciotomy is needed to be done as soon as a surgeon detect there is compartment syndrome to prevent further damage to the tissue in this compartment. The fasciotomy is simply the incision of the fascia of the particular compartment. Okay, some things about the fascia of the thigh. There is an iliotibial tract. Okay, iliotibial tract is a longitudinal band that forms from thickening of the fascia lata. Okay, the fascia lata, it is located along the lateral margin of the thigh. Attachment of the iliotibial tract is from the iliac crest, and up, down until the lateral condyle of the tibia. So this is the iliotibial tract, the thickening part of the fascia lata, the deep fascia of the thigh. What is the clinical anatomy of the iliotibial tract? One of it is the snapping hip. The snapping hip is a condition in which you feel a snapping sensation or hear a popping sound in your hip when you walk. Okay, get up from a chair or swing your leg around. So this is happen when the tightness happen around this area, around the attachment of the muscles in the proximal part of the femur, the greater trochanter and all that. So this tightening causes the iliotibial tract to cross over the greater trochanter and producing the snapping sensation or the popping sound. It can be either painful or painless. Depends on the causes of the tightness around this area. Okay. Okay, now we go to the muscles of the lower limb. The second part of my lecture. The muscle of the lower limb can be described based on the region. Okay, we have actually 4 regions for the lower limb. So the gluteal region, the thigh, the leg, and the foot. Okay, the gluteal region is here. Okay, the gluteal region lies behind the pelvis, behind the pelvis bone, between the iliac crest and the lower border of the gluteus maximus. So this region is known as gluteal region, right? The gluteal regions has 2 groups of muscles. Okay, one deep group and another one superficial group. So deep group, of course lah, it's located deeper. And superficial is superficial. So the deep group are 5 muscles: the piriformis, the quadratus femoris, obturator internus, gemellus superior, and gemellus inferior. While for the superficial group, you have 3 gluteus muscles, the gluteus maximus, medius, and minimus, and another one is the tensor fasciae lata. Okay, the superficial group first, which is the gluteus maximus. Gluteus maximus is this one. It is the biggest muscle in human body. It's the gluteus maximus. Well, for undergrad, I don't really emphasize on the origin and insertion of the muscles, but it is important for you to know the movement of the muscles, the movement that produced by the contraction of the muscle by knowing the origin and insertion of that particular muscle. So for the gluteus maximus, the origin is along the posterior gluteal line. Remember your hip bone. There is posterior gluteal line, the anterior and the inferior gluteal line. So the gluteus maximus is attached along the posterior gluteal line and also the lateral side of the sacrum and coccyx. Okay, this is the origin. And the insertion of the gluteus maximus is at the gluteal tuberosity of the femur and also the iliotibial tract. So when you know the origin and insertion of a muscle, actually you know the action of that muscle. So for instance, in gluteus maximus, when it origin at this area, the contraction will produce a lateral rotation of the hip the lateral rotation of the hip. So this is actually posterior view. This is posterior view. So when the gluteus maximus contract, it will produce lateral rotation. So imagine the muscle, the gluteus maximus is attached here. It contract. So it move the hip joint laterally. So it actually laterally rotate the hip joint. So it laterally rotate the thigh. It also produce extension of the hip joint. The nerve supply for the gluteus maximus is by the inferior gluteal nerve. So the gluteus maximus attachment point from the posterior gluteal line and also the lateral aspect of the sacrum and coccyx origin insert at the gluteal tuberosity of the femur. The gluteal tuberosity of the femur. Okay, the next two is the gluteus medius and gluteus minimus. The gluteus medius and the gluteus minimus. For origin and insertion of these gluteus medius and minimus, the gluteus medius attached at the anterior gluteal line, while for the gluteus minimus attached at the inferior gluteal line. They both attach at the greater trochanter of the femur here. The action of the gluteus medius and minimus is to abduct femur at hip joint and rotates the thigh medially. So it's controlled with the gluteus maximus. So the maximus, they rotate the thigh laterally, while for these two muscles, they rotate the thigh medially. These two muscles also important in prevent pelvic drop over the opposite swing limb during walking. So it's actually to stabilize the pelvis in walking. It's supplied by the superior gluteal nerve. Okay, again, the origin of the gluteus medius and minimus, anterior gluteal line is for the gluteus medius and inferior gluteal line is for the gluteus minimus. Both of them attached at the greater trochanter of the femur. Okay, this is the action of the gluteus medius and gluteus minimus. It produces abduction of the thigh on the pelvis, abduct. So it swing away the thigh. All right. This is one. Another one is actually to extend the hip. Extend maksudnya dia move backward. Move the thigh backward. Okay, in a condition of that causes the gluteus medius and gluteus minimus weakness, the person might show you the Trendelenburg sign. Okay, what is this? Okay, in a normal gait, normal gluteus medius and minimus muscles, when one leg up, so for instance in this picture, this is the left leg up. When this left leg up, so the opposite gluteus medius and minimus muscle will contract. So why they need to contract? This is to ensure the level of the pelvis is in level, total level, dia tak sengit, okay? Failure of this will cause Trendelenburg sign. So in patient with weakness of these two muscles, the gluteus medius and minimus, they will fail to produce the contraction of these two muscles and thus the pelvis become tilt. So Trendelenburg sign is there. So whenever the patient move up the left leg, so the opposite leg fail to contract its gluteus medius and minimus, and the patient will have this tilt pelvis. This is known as Trendelenburg sign. Okay, this is a picture showing the positive Trendelenburg sign. So in this picture, which part of the train gluteus minimus and medius is actually paralyzed? You can answer this question by answering my assignment in the elite. Okay. Now we go to the another muscles, which is the tensor fascia lata. The tensor fascia lata, this muscle, a very small muscle. Its action is to assist the gluteus maximus in maintaining the knee in the extended position. Uh, uh, this muscle is also supplied by the superior gluteal nerve. All right, so then we go to the deep group muscles, the piriformis muscle. So the piriformis muscle, okay, it passes through the greater sciatic foramen. Remember your greater sciatic foramen? The greater sciatic foramen, the piriformis muscle passes through this foramen. Because of this, the foramen divided into the two foramina, so two region of the foramen. The one region above and one region below the piriformis muscle. The action of this muscle is to lateral rotation and abduct the femur at hip joint. So yeah, it's actually helping. It's same with the gluteus maximus. The nerve supply that supply this muscle is branches from the S1, sacral 1, and S sacral 2 of the sacral plexus. And another four muscles of the deep group. Okay, one is the gemellus superior. Gemellus superior, and then you have the obturator internus. Cover the obturator foramen internally. Okay, and then you have the gemellus inferior below the obturator internus and quadratus femoris. They all are the lateral rotator of the femur at hip joint. The nerve supply for the gemellus superior and obturator internus is by the nerve to obturator internus, while the gemellus inferior and the quadratus femoris are supplied by the nerve to the quadratus femoris. Okay, this is the table showing the muscles, their innervation, and the main action. You can always refer this to this table later when you want to to do the assignment in this lecture. So this is the superficial group. All of them are supplied by the superior gluteal nerve, except the gluteus maximus, which is by the inferior gluteal nerve. All right, this. And then the muscles of the deep group, the piriformis, obturator internus, gemellus superior, supplied by the nerve to obturator internus, gemellus inferior, and quadratus femoris are supplied by the nerve to quadratus femoris. All of them rotate the thigh laterally. Okay, this is your exercise. Okay, I want you to complete the assignment by listing the muscles that abduct and adduct at the hip joint. All right. And another third question is the muscle that lateral and medial rotate the hip joint. Medial rotate and lateral rotate the hip joint. And then the muscle that extend and the flex at the hip joint. So you have to answer this exercise and submit it on Elif later on. Just give me the name of the muscle. Okay, now we go to the muscle of the thigh, the second region of the lower limb. Okay, the muscle of the thigh. Before I begin, thigh is the region between the lower limb region of the lower limb between the hip, between the hip and the knee joint. So this is thigh. Okay, the thigh is divided into three compartments by intermuscular septa, anterior, posterior, and medial compartments. Okay, interior, posterior, and medial compartment. Anterior, posterior, and medial compartment. They are the tiga compartments of the muscle in the thigh. So, for easy for you to remember, there are each of these compartments have their common actions, innervation, and blood supply. Okay, like for instance, for anterior compartment of the thigh, the action is mainly extend the leg at knee joint. They all are supplied by femoral nerve and femoral artery. Well, there will be some exception of some part of the muscles in this, but generally they are supplied by femoral nerve and femoral artery. For the medial compartment of the thigh, the motion, the muscles that mainly adduct the thigh and hip joint. They are supplied by obturator nerve and obturator artery. And some of the muscles are supplied by profunda femoris artery. While for the posterior compartment of the thigh, the action is mainly extend the thigh at hip joint and flex the leg at the knee joint. So when you say about the action of the muscle in each compartment, you have to mention to extend the hip. It's either you say directly to extend the hip or extend the thigh at hip joint or to flex the leg at knee joint. So the movement is actually formed at the joint. Okay, the flexion at the knee joint. And the muscle of the posterior compartment of the thigh are supplied by sciatic nerve, and the blood supply is by the branches of profunda femoris artery. Okay, let's go to the anterior compartment of the thigh first. Okay, you have one. The first is the sartorius muscle. Second, vastus medialis, rectus femoris, vastus lateralis, vastus intermedius, and what not seen in this cross section is the pectineus muscle, psoas major, and iliacus muscles. So I repeat again: the sartorius muscle, three vastus, okay, vastus medialis, vastus lateralis, and vastus intermedius, and one vastus femoris. So 1, 2, 3, 4, 5. So another three is the pectineus, the psoas major, and iliacus muscles. Okay, you have the psoas major muscle, the iliacus muscle, the pectineus muscle, the sartorius, the rectus femoris, vastus lateralis, vastus medialis, and vastus intermediate below this rectus. Vastus lateralis, intermedius, and medialis. The action of this group of muscles is to extend the leg at knee joint and flex the thigh at hip joint. They're supplied by the femoral nerve and artery. So anterior is supplied by femoral nerve and femoral artery. Except for the psoas major up here, which is supplied by the anterior line of the lumbar plexus. Again, the picture showing the psoas major muscle, the attachment, psoas major and iliacus muscle, the pectineus. The sartorius is the largest muscle, the longest muscle in the body. And you have the quadriceps femoris group of muscles. So what is quadriceps femoris? Okay, quadriceps femoris group of muscles. Okay, it's a group of muscles. Consists of 4 muscles: the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedia below the rectus femoris. All of them are attached first to patella. So this is the patella. They first attached to patella by quadriceps femoris tendon. quadriceps femoris tendon, and then by the patellar ligament to the tibia. So it actually has two attachments. Okay, one is the patella, and the extension of the attachment is to the tibia. So it has two tendon, the quadriceps femoris tendon and also the patella tendon. Together they provide powerful extensor of the knee joint. So because they are powerful extensor of the knee joint, and they are actually muscle for kicking the ball if you are playing football. So the quadriceps femoris muscle is doing that action, extend the knee joint. But for exception for the rectus femoris, it also has some function in flexing the thigh, flexing the thigh at the hip joint. All of them are innervated by femoral nerve and supplied by the femoral artery. Okay, the muscle of anterior compartment. The first five is extend the knee joint. The lower five, they flex the hip joint. So rectus femoris, sartorius, psoas major, and pectineus and iliacus. So this is the table you can refer anytime later on. So now we'll go to the medial compartment of the thigh. So we have the muscles in the medial compartment. Number one is the adductor longus. Adductor longus, and then you have the adductor magnus, gracilis muscles. What's not seen in this cross section is adductor brevis, obturator externus. So we have five muscles of the medial compartment, the adductor longus. So all the adductor longus, adductor magnus, adductor brevis, gracilis, and obturator externus. Five muscles of the medial compartment. The action of the muscles in this medial compartment is adduct the thigh and hip joint. Okay, they supplied by obturator nerve, and the blood supply is by obturator and profunda femoris arteries. Okay, except for the hamstring part of adductor magnus. Okay, I'm going to talk about this later. The hamstring part of adductor magnus is supplied by the sciatic nerve. Okay, you have how many muscles again in the medial compartment? You have five muscles of the medial compartment of the thigh. You have the adductor longus. Okay, they have been cut in this picture. The adductor longus, the adductor brevis. What does longus mean? Longus mean long. Brevis mean short. Okay, adductor longus, adductor brevis. And then you have the obturator externus. Remember, the obturator internus is the muscle of the gluteal region. So the obturator externus is muscle of the thigh region, particularly the medial compartment. So we have the obturator externus. Actually, they cover the obturator foramen. Obturator externus, the gracilis. And you have the biggest muscle, which is the adductor magnus. So 1, 2, 3, 4, 5 muscles of the medial compartment. Okay, another picture showing the obturator externus. Okay, the adductor brevis, adductor longus, adductor magnus. All the adductors insert into linea aspera. So remember your linea aspera, the parts, the structure or the features that are present in the femur. Okay, you have to know all this. What is this? The greater trochanter. What is this? And what is this? Oh, you have to know. Okay, the linea aspera is the attachment for the adductor muscles. Okay, as I said, I want to talk about the adductor magnus. Adductor magnus mean big. Yeah, magnus mean big. Magnus, adductor magnus is this so big. It has two parts. two parts, the adductor part. The adductor part and the hamstring part. Hamstring part. Adductor parts originate from the ischiopubic ramus. Do you know where is ischiopubic ramus? It is in your hip bone, the ischiopubic ramus, and insert at the linea aspera. Okay, remember the linea aspera of the femur? While for the hamstring part, is this one. Okay, hamstring part is originate from the ischial tuberosity. So remember your ischial tuberosity is the part of the hip bone that when you sit is actually the ischial tuberosity is actually the part that you are sitting on, the ischial tuberosity. Okay, the ischial tuberosity is where the hamstring part of the adductor magnus originates, and it's attached at the adductor tubercle of the femur. Adductor tubercle of the femur. So because these two parts of the adductor magnus has two insertion point, so in between these two parts there is a gap or a hiatus or opening. Okay, this hiatus, adductor hiatus, allows femoral artery and femoral vein to pass between the thigh back to the popliteal fossa. Okay, the medial side of the thigh to the popliteal fossa is the fossa that is located at the back of the knee, posterior to the knee. The muscle in the the adductor magnus, it also has two nerve supply, depends on its parts. Adductor part is by the obturator nerve, along with it's actually the same with the other muscles in the medial compartment. Like the hamstring part is by the sciatic nerve. The sciatic nerve. Okay, this is the adductor hiatus. Adductor part insert at the linea aspera, while the hamstring part insert at the adductor tubercle. Okay, this is the table. You can refer anytime. And the revision, we have 5 muscles in the medial compartment: the gracilis, obturator externus, adductor longus, adductor brevis, and adductor magnus. And now we go to the last compartment of the thigh, which is the posterior compartment of the thigh. So this is the posterior compartment of the thigh. Okay, this is made of semimembranosus, semitendinosus, bicep femoris muscles. Only 3 muscles of the posterior compartment: the bicep femoris, so the bicep femoris, this one, the semimembran tendinosus, tendinosus and semimembranosus is here. Okay, they all extend the thigh at hip joint, and supplied by the sciatic nerve, and the blood supply is by the branches of profunda femoris artery. Kalau anterior part, we have the quadriceps femoris muscles. So for the posterior compartment, we have hamstring group of muscles. Okay, hamstring group of muscle, anterior quadriceps, posterior hamstring. So the hamstring group of muscle consists of the semimembranosus, semitendinosus, and bicep femoris, only the long head. Okay. So I repeat again, the hamstring muscles are made of semitendinosus, semimembranosus. I think this is semitendinosus. This is semitendinosus, and semimembranosus is here. Because why semitendinosus is actually it has long tendon. Semimembranosus is this one. Okay, it's actually just the labeling problem. And then you have the bicep femoris muscle. Which one? The long head one. Okay, it has 2 head. I will explain later. The long head of the bicep femoris, along with the semitendinosus and semimembranosus, they are collectively known as the hamstring group of muscle. Hamstring are extensor of the thigh and flexor for the leg, especially during walking. Okay, for the bicep femoris muscle, it has two heads. Okay, first is the long heads. Okay, long heads yang tadi tu yang I said it is part of the hamstring muscles, and short head is here. The long head originate from the ischial tuberosity. Okay, ischial tuberosity, while the short head originate from the shaft of the femur. The muscle fibers from two heads join to form a tendon, which attach at the head of fibula. Okay, the innervation for the long head is by the sciatic nerve, and for the short head is by the common fibular nerve. Okay, this is the mark table for the muscles innervation and their main actions. Okay, now we go to muscle of the leg. For the muscle of the leg, we have also three compartments. We have anterior compartment, posterior compartment, and lateral compartment. The difference between the compartments of the leg and compartment of the thigh are whether it has medial or lateral compartments. Both of them have anterior and posterior compartment, but for the leg it has lateral compartment, while for the thigh it has medial compartment. Okay, if I ask you this muscle is belong to which compartment, if I asking you the muscle of the leg, if you answer medial, you are totally wrong. So for the muscle of the leg, there only has lateral, no medial compartment. So anterior, posterior, and lateral compartments of the muscle of the leg. All right. Okay. It's like in the compartment of the thigh. Muscles in each compartment have common actions, innervation, and blood supply. So like for anterior compartment of the leg, they're mainly dorsiflex. Dorsiflex ni? Flex up. Dorsiflex. And invert the foot. They're supplied by deep fibular nerve. And the blood supply is by anterior tibial artery. Anterior tibial artery, anterior compartment. Anterior tibial artery, anterior compartment. While for the lateral compartment of the leg, they are mainly evert the foot. So evert the foot. This one. Because they are located at lateral kan, so they evert lah. Okay, and then the nerve supply of the lateral compartment of the leg is by the superficial fibula. Kalau anterior deep, kalau lateral it is by superficial fibular nerve. The blood supply of the lateral compartment, there is no major artery passes vertically through the lateral compartment. It is supplied by branches from the posterior compartment of the leg that penetrate into the lateral compartment. So it's received the same blood supply from the posterior compartment of the leg. And for the posterior compartment of the leg, the muscles are mainly plantar flex, plantar flex, and invert the foot and flex the toes. The blood supply for the posterior compartment is by the posterior tibial artery, and the innervation is by the tibial nerve. Okay. We have two anterior for anterior compartment. Tibial artery dia ada two. Dia ada dua anterior tibial artery which is by the anterior compartment, and posterior tibial artery which is by the posterior compartment of the leg. Okay, these are all the muscles in each compartment. Oh, sorry. So anterior compartment. Anterior compartment is supplied by the what nerve? It is by the deep peroneal nerve, lateral superficial peroneal nerve. So, kalau blood supply anterior compartment is by the anterior tibial artery, posterior is by the posterior, and deep posterior and lateral is by the posterior tibial artery. So we go to the anterior compartment of the leg first. Anterior compartment of the leg consists of these four muscles. Okay, what the muscle that are visible in this cross section are the tibialis anterior and extensor hallucis longus, extensor digitorum longus. What is hallucis? Hallucis is your big toe. The digitorum is the small toes. And another one is the peroneus tertius or fibulary tertius. Okay, the tibialis anterior muscles, extensor hallucis longus, extensor hallucis dia pergi dekat helix. Helix is the big toe, and the extensor digitorum is the small toe. Is go to the small toe. Okay, the dorsiflex and invert. They're supplied by deep peroneal nerve and inferior tibial artery. So it's this, the extensor, the fibularis tertius is this one. Okay, fibularis tertius is part of the muscle that are attached at the fibula. Okay, there are three muscles that attach to the fibula. One of it is fibularis tertius. So fibularis tertius is grouped into anterior compartment of the leg along with the tibialis anterior, extensor digitorum longus, and extensor hallucis longus. Longus means long. Okay, tibialis anterior. All the muscle of the anterior compartment supplied by the deep fibula nerve. And the function of the muscles in anterior compartment is dorsiflex and extension of the toes. Okay, kalau hallucis, extension of the great toe, the big toe. Kalau digitorum, extension of the lateral four toes. Fibularis tertius is dorsiflexion and eversion of the foot. Okay, as I mentioned, for the muscle that attach to the fibula, there are three muscle. Peroneus longus. The other peroneus is actually fibula. Fibularis is also the same name. Okay, peroneus longus or fibularis longus or peroneus brevis and peroneus tertius. All right. Okay, now we go to the lateral compartment of the leg. It has only two muscles, the fibularis longus and fibularis brevis. Longus and brevis. The action of this muscle is to evert the foot, and they are supplied by superficial peroneal nerve. Then there are picture showing the fibularis longus and fibularis brevis. Okay, the table that you can refer to. So the table for muscle innervation and main actions of the muscle in the lateral compartment. Now we go to the posterior compartment. Okay, for the posterior compartment of the leg, they can be divided into two compartments: the deep posterior compartment and the superficial posterior compartment. So we can look at the deep group of the muscles. The deep group muscle, there are four deep group. Number one is not seen in this cross section, popliteus. Second, you have the tibialis posterior muscle, and then flexor digitorum longus and flexor hallucis longus. Ini deep group. Deep group ada 4. Popliteus, tibialis anterior, flexor digitorum longus, and flexor hallucis longus. While for the superficial group, the plantaris is not seen in this picture. And then you have the soleus, big muscle here, and gastrocnemius. It has two heads, the lateral head and the medial head of gastrocnemius. So 1, 2, 3 muscles: plantaris, plantaris soleus, and gastrocnemius. So the muscle of the posterior compartment, the action is to plantar flex, invert the foot, and flex the toes. The innervation is by the tibial nerve. Which one? Which one of the nerve? Tibial nerve lah. Alright. And then the blood supply is by the posterior tibial artery. The calcaneus, the tendon that attach the gastrocnemius muscles to the calcaneum. Do you know what is calcaneum? Calcaneum is the bone of the heel. Okay, the calcaneus. The Achilles tendon or the calcaneal tendon is the biggest and the strongest tendon in the body. Okay. So whenever an athlete have this Achilles tendon tear, it is really, really painful. So to examine this condition, the doctor will passively contract the muscle of the posterior compartment of the leg. If the tendon is there, there will be no plantar flex action visible when the doctor compress these muscles. But when the tendon is intact, there will be dorsiflexion movement of the foot. So maksudnya dia okay lah. And the posterior compartment, popliteal muscle. This is the popliteal muscle. It is part of the muscle of the posterior compartment. When the knee is in full extension, the femur slightly medially rotate on tibia to lock the knee joint in place. Okay, faham tak? When knee is in full extension. So maksudnya the knee is tegak, okay, straight. The femur slightly medially rotates on tibia. Okay, ni femur slightly medially rotates to lock the knee joint in place. So joint knee jadi stable lah. But whenever that person want to start walking, to unlock this lock knee, the popliteus will contract so that the femur will rotate laterally on the tibia to unlock this position. So these are the tables of the superficial and deep groove muscles in the posterior compartment of the leg. Okay, now we go to the last region of the lower limb, which is the foot. So kalau the foot ni muscle of the sole lah, the sole and the dorsum. Sole tu tapak kaki and dorsum is the above part of the foot. So the muscle of the sole can be organized into 4 layers. The first layer, the second layer, third layer, and fourth layer. The first layer, it has 3 muscles, the abductor hallucis, and hallucis means big toe, and abductor digiti minimi, abductor of the smallest toe. And then the flexor digitorum brevis. Okay, kalau brevis, digitorum, the 4 small toes, the first is the muscle of the first layer. And the second layer, it contains the quadratus plantae and lumbricals, the 2 muscles. For the third layer, it contains the flexor hallucis brevis, hallucis means big toe, flexor digiti minimi brevis, and adductor hallucis. The fourth layer contains the dorsal interossei and plantar interossei. Okay, the first layer dia ada tiga: abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. Okay. For the second layer, it has lumbricals. The lumbricals ni adalah lumbricals and quadratus plantae. Now the third layer is the adductor hallucis. For the hallucis saja dia ada banyak muscle fibers. Okay, for only one toe, the big toe. And you have the flexor digiti minimi brevis. Flexor hallucis brevis. And the fourth layer, the deeper one, okay, it is the plantar interossei. Plantar interossei muscles and dorsal interossei. The first three fibers is dorsal interossei, while for the rest is the plantar interossei. Plantar interossei is adduct the toes at the metatarsophalangeal joint. Abduction of the toes at the MPJ is by the dorsal interossei. Where is the metatarsophalangeal joint? So this is the tarsal bone. This is the metatarsal. So the joint is here. Okay, this is the graphic or the picture showing the layers of the sole, muscle of the sole of the foot. Okay, the first layer, the outermost, second layer, third layer, and the fourth layer. What a muscle in the dorsum of the foot? There is two: the extensor hallucis brevis and extensor digitorum brevis. So this is actually the nerve, the innervation of the muscles of the lower limb for the thigh, thigh adduction. The muscle is adductor longus and brevis. The segments of the muscle, the nerve that supplying these two muscles is actually emerged from the spinal cord level L2, L3. So when someone has injury involving the spinal cord at this level, the patient might have problem in adducting the thigh. And if it is involved in L3 and L4, the patient will have problem in knee extension. The muscle involved is quadriceps. When the patient is unable to dorsiflex the ankle, dorsiflex the ankle, the level of the spinal cord is at L4 and L5. If the patient cannot extend the great toe, it is L5 and S1. And if the patient cannot plantar flex the ankle, it is at the level S1 and S2. Yeah, I think that's all for the muscle of the lower limb. Now we go to the intermuscular spaces. Okay, intermuscular spaces is really, really important for you. Yeah, especially it is frequently asked in OSPI. Okay, regardless of whether it is in a blog or if your final first professional. So don't get don't miss these intermuscular spaces, especially for OSPI. Okay, what are the intermuscular spaces available in the lower limb? Okay, there are three intermuscular spaces that you have to know all of it. Okay, the femoral triangle, this region, adductor canal, and the popliteal fossa behind the knee. This is the femoral triangle, is this region, okay? Do you know where is this? This is your thigh. So this is your abdomen, and this is the groin. Okay, the femoral triangle. It is bounded by the inguinal ligament. This is the inguinal ligament. And then you have the sartorius muscle as its lateral boundary, and then the medial border of adductor longus. So this is adductor longus, and this is the sartorius. Sartorius, um, medial, the medial border, which is the lateral boundaries, the lateral border of the intermuscular femoral triangle space is by the sartorius muscle. Medial border is by the adductor longus, and the floor is by the iliopsoas muscle, the pectineus muscle, and the adductor longus muscle, the three muscles that form the floor. And then it contains the femoral nerve, femoral artery, and femoral vein. And the roof is formed by the deep fascia of the thigh, which is the fascia lata. So you have to know this. Don't miss this, okay? And then the second, okay, it's still same. The femoral triangle. So let's repeat again. The superior boundary is by the inguinal ligament. The lateral border is by the sartorius muscle, and the medial border is by the adductor longus. The floor is formed by the iliopsoas muscle, pectineus muscle, and adductor longus muscle. While the content, it contains the femoral nerve, femoral artery, and femoral veins. And you can also put in the lymph nodes, the deep inguinal lymph nodes in it. It's okay. And then what I want to show you in this picture is the femoral sheath. The femoral sheath is the coverage of the sheath that cover the femoral vessels. This one, femoral sheath. This one, okay. This one, the first few inches of femoral vessels. Femoral canal is this one. So any femoral sheath cover the vessels. Femoral canal contain the lymph nodes, the connective tissue, and the fats. It is a potential weak area. So this area is potential weak area for the femoral triangle. So because of this, the femoral herniation, which occur frequently in women, can easily happen in this area. Okay, this is femoral hernia. The femoral hernia, herniated intestine, causing visible bulge because of the weak area of the femoral triangle around the femoral sheath and femoral canal. Now the second space is adductor canal. Okay, it's just simply this one, the adductor canal. This is the adductor canal. So the sartorius muscle has been cut in this picture, exposing the adductor canals. So because of that, it is also known as subsartorial canal because it is located behind the sartorius muscle. Well, the adductor canal begins at the apex of the femoral triangle here, ends at the opening of the adductor hiatus. Remember our adductor hiatus? The gap between the insertion of the adductor magnus muscles. Okay, the adductor canal is located at between the apex of the femoral triangle up until the adductor hiatus down here. It contains the femoral vessels, the saphenous nerve, and nerve to vastus medialis. And the popliteal fossa, okay, the last intermuscular spaces. Popliteal fossa is behind the knee. Okay, it's located behind the knee. It's bounded superomedially by the semimembranosus and semitendinosus. Semimembranosus and semitendinosus is from its superomedial. It's diamond shaped space. Okay, so it's superomedially is bounded by semimembranosus and semitendinosus, while superolaterally by the bicep femoris muscles. Inferiorly is by the medial and lateral heads of gastrocnemius. It contains the popliteal vessels. The popliteal vessels that include the superior medial genicular artery, popliteal vein and artery, and what else? The tibial nerve, and the branches, and small saphenous vein. Semitendinosus, bicep femoris, gastrocnemius medial and lateral head, and these are all the contents of the popliteal fossa. And for all these intermuscular spaces, you have to know their boundaries, they contain their roof, if there is, the floor of the spaces. Okay? Yeah, I think that's all for today. I think that's all for the muscle of the lower limb. So, if you want to know, if you want to explore further, you can go to this humanbiodigital.com, and this is my references. Okay, Plus Anatomy book, textbooks, and Teach Me Anatomy online, and can help. I think that's all, and thank you for your attention.